good morning from Sherry Forsyth, the Peak Performance Coach, and I am continuing in my series on health-related issues. What we're trying to do is we are trying to open the discussion on various illnesses, how people have coped with them, and we also are opening the discussion on that there are lots of different ways or approaches that might be helpful. From allopathic doctors all the way through to the various different modalities of complementary health. And so I'm hoping to get you having a much wider view of your own situation with your health. So I welcome today Dr. Georgie Makris, a homeopath who works here in Hilton. And so we're going to be discussing today how homeopathy can help you in the various illnesses you might have. So welcome, Georgie.
Thanks, Sherry. Good to be with you this morning on this misty day in Hilton.
Yeah, as always.
As always.
So Georgie, my first question to you is, in order to study to become a homeopath, how long is the study period? What kind of things what kind of subjects do you study?
Okay, well, I've been in practice for 25 years, so I'm kind of a little bit out of what they're actually studying at the moment. But the course is a 5-year basic course, and then they do a year's internship. So the internship involves a research project and working in the clinic. At the moment, they are still trying to get internship programs set up with practitioners, but it's quite a difficult thing to do because of how people's practices are structured. So the reality is you in the first 2 years, you do all your basic medical sciences, you do the study of a cadaver, you do dissection, you do pathologies and all the natural sciences, starting with obviously biology, chemistry, biochemistry, all those sort of things. So you do a basic medical start, and then you go on and you start studying the homeopathic medications and how to treat a patient homeopathically, because it's holistic. So you're not just looking at a disease, you're not just looking for a disease, you're looking at somebody's mind, body, spirit, how they live, what they eat, all sorts of things come into it, because it's never just one thing that is creating a disease in somebody. So it's quite a very holistic looking, and they do a lot of modalities on massage and nutrition. And so as you go and you do 6 months on many different things so that you have a broad idea of how to treat people holistically. And then obviously there's the internship and the research project, which is really important because obviously that betters homeopathy in the future. So the research is quite, they kind of look at that quite intensely at the time because it betters where homeopathy is going. So I do a lot of provings at the Durban Tech. It is not at university. It is done at the Durban Technikon. It's called that Durban University of Technology now, and at the UJ, which is, so those are the two places that do it at the moment, and the only 2 courses in this country. Post-grad, there are courses that medical practitioners can do. So if you're already qualified as a doctor, there are courses you can do, and those I think involve having to do 500 hours and over 3 years, and obviously clinical work and things like that.
So then those are doctors who are trained allopathically and homeopathically?
Yes, so they will be trained allopathically. They have gone to one of the medical schools, and then they will go on, and very few who do that. But there are those who find once they've gone into medicine are a bit disillusioned with what's going, or they want to be able to prescribe homeopathically as well, and so then they go into that as well. Not many of them, but there are some.
And so Georgie, as a homeopath, can you specialize in a certain area, unofficially or officially?
There are homeopaths who take an interest in something, and so obviously research into diabetes or childcare or whatever it might be. But homeopathy is for everybody, so it's based on a holistic thing, and it doesn't matter really. You're looking at the person, not at the disease. So for me, it's I've never wanted to specialize in anything, but I guess there are homeopaths who say they have an interest in, they can't specialize in it. So they'll say they have an interest in diabetes or an interest in pediatrics or gynecology or whatever. So yeah.
Okay.
Yeah.
So there's no formal specialization, which would actually probably be counterproductive because you are trying to look holistically, and if you specialize, you're going to be only honing in on one area, not the whole being.
Yes, I would say, that's homeopathy is about being holistic.
Yes.
So to specialize, but I say if you have a real interest or passion, or you've had somebody who's been ill in your family, like my brother had asthma as a child, so it was always interesting for me to find out how to treat an asthmatic because a homeopath cured him. That was how he got better, and that's why I became interested in it. So for me, there's always been an interest in that, but it's not where I would base my whole practice.
Yeah. Okay. Yeah. And what is the basic premise of homeopathic healing?
So the main principle, which was set up by the father of homeopathy, is a chap called Samuel Hahnemann, and so homeopathy's been around for about 170 years. So it's not a new thing that's just fangled onto our into our paths. It's been around for a long time, and he was actually a German physician who was completely disillusioned with, in those days they used to do blood leaching and all sorts of
horrible
things you don't want to do. So he was really just disillusioned with what was happening. So he started experimenting with different things, and he came up with this. It's called similibus curenta, which is like cures like. So in actual fact, what you're looking at is things that can cause symptoms in people will cure those same symptoms if they're seen in somebody who's diseased.
Oh, wow.
Okay.
Okay.
So I'll give you an easy example for nowadays, because obviously we all know about coffee. And if you take coffee, ingest coffee in great quantities, you end up having insomnia,
Racing heart.
Yeah, racing heart, anxiety, overactive mind, massive dreams. You become a bit on top of everything. And so one of the remedies in homeopathy that helps with insomnia, helps with overactivity of the mind, is a remedy called coffea cruda, which is made from coffee.
Okay, wow, okay. That's quite amazing.
So that's what the base of all homeopathic remedies is like cures like.
Okay.
So the similibus curenta is the most important thing that we're looking at. And we have to find a remedy that matches your symptoms. That is what a homeopath is looking for.
Okay, so could two people with the similar symptoms but very different backgrounds and personalities, would they necessarily be treated with the same thing, or would they be matched? Would the remedy be matched to them holistically? In other words, personalized.
Yes. So let's go back to that insomnia thing. So yes, we have that person who's overactive, waking up in the morning, and their mind's just going berserk, and they actually can't concentrate. So they're just like all over the place. You look at coffea. Whereas you have other people who have similar symptoms, waking up at the same time, but they more lethargic and you're looking at a different remedy. Okay. So like a Max Vomica, just for interest sake. But so there are many remedies. So every person can have the same disease. So you can have people who've got a sinus, a cold, a cough, anything, and they'll get completely different remedies.
Okay.
So it's one thing when I see a family, it's quite important to say, don't give it to another child. It might help, but it might not be the right remedy for them.
Yeah. So it's very specific for the person.
It is specific. And you get to know patients. So there will be patients who have a basic kind of remedy that you follow with them. So, if somebody is a certain kind of remedy picture, you know that those remedies are going to help them along the way. Might not always be the same remedy, but they'll be in the salts or in, So there are remedy patterns that are followed as well. Yeah, so it's very interesting because each person is individual. So even if I see a family of 6 people and they've all got a cold, they can all get different remedies.
Okay. So very personalized.
Yeah, it is.
Yeah.
Which is lovely because, that's what I love is, to see this, just looking for a disease all the time is quite difficult. Whereas you're looking at a person, you understanding a person, that's what's important.
And just on a personal note, after the loss of our younger daughter, I developed chest complaints, which I'd never had before. And I can only imagine what it does feel like to have bronchitis or pneumonia. But that's how I felt. And so I phoned Georgie to say, please, help. I'm really battling. And I saw her at 11:30. You squeezed me in. I saw Georgie at 11:30, and she gave me a remedy, bearing in mind that my body and my mind was very traumatized at that stage. After I'd seen Georgie, I did the little school run, and then our daughter was swimming in a gala that afternoon. When I was sitting watching the gala, and I don't even know if I've ever told Georgie this, when I was sitting at the gala, so it was 3 o'clock or just after, my chest was entirely clear. And I've been taking Georgie's drops every hour, I think.
Probably every hour?
Yeah, probably every hour, because it was acute. I went from feeling like I was dying of pneumonia to feeling absolutely perfect, because the emotional, the holistic, I'd been treated holistically and not just symptomatically. So that, I think, is a huge thing.
Yeah, and back then I probably really actually treated the grief.
Yes.
Because that was, where you were at that
yes.
time. And it was an emotional outburst of, where your system was. So,
so can homeopathy help with emotional things as well as physical things?
Oh, definitely. I treat a lot of emotions. I mean, I think probably 80% of my patients actually, in the end, our physical is often a representation of where we are emotionally.
Yeah.
And so we have to deal back to that always. So I often treat on both levels at the same time. I'll treat physically and I'll treat emotionally, because you can't miss that if you're missing that. And essentially, unfortunately, it's one of the things where they lack allopathically, is that they can't treat the emotion. And so they really battle with that. And I understand that. You can give an antidepressant, which helps long term, but is it really helping the person at that time to clear the infection that they've got, if the infection has been promoted by an emotion? So it's always important. And it's one of the things that, I know that you can always clear up a disease with an antibiotic. You can clear a bacteria, but are you helping the person inside and emotionally to actually get past that? And that's what's important sometimes.
So you can clear it like with an antibiotic, and then is there a likelihood of recurring infections? Whereas you go to the heart and soul of the matter. Is that kind of what you...
Yes, sort of. I mean, obviously it's not always. Sometimes you have one antibiotic and it's cleared. Yeah. And so it's just a basic bacteria that the person has picked up in a supermarket or whatever. But the premise really, when you're looking at with homeopathy, is you want a long-term better body. You want to be able to cope long-term with the odd cold, flu thing that is picked up, and you want to be able to clear it quickly. And with homeopathy, you often find that people will get vaguely sick and then they'll be fine. And so they're never falling into where they're off work for weeks. But the beginning, when they start getting treated homeopathically, that can be tough for people, because you have to get the body's response. So homeopathy is like a catalyst. I'm not giving you something that is going to eliminate something. Okay. So if you give an antibiotic, you are looking at elimination of a disease or a bacteria, or it changes the system. Whereas homeopathy gently makes your body actually do the work. So it's a catalyst. Yes.
Catalyzes your healing.
Yeah, so you choose different remedies to help the body in different areas, but the reality is that it's a catalyst. Your body actually has to do the work. So long term, your body is actually getting better. That is how it works.
Okay.
So it's a strengthening.
Okay. And so sometimes the homeopathic medication, if you can call it medication, takes longer. Like if I go with a cold, let's use the same thing of a bacteria. I've got a pneumonia.
Let's hope not. He might not be with us. He might be in hospital. But yes.
So if I've got a pneumonia and if I go allopathically, and then I'll be put into hospital, whatever, and I will in a few days I'll start feeling better. Is it true that you take slightly longer when you're taking homeopathic remedy?
Yes and no. Okay, so yes, if it's a very acute condition and we treat it acutely and we you give the remedy really regularly to try and help the system cope, you can get better really quickly. So it's not always, it depends on how quickly you catch something. So if you've left something for 10 weeks or 3 weeks or 2 weeks, it's more difficult to get the response quickly, because then it's already ingrained in your system and your body actually has to work harder to get past it. Whereas if it's, I always say to people, try and come and see me as soon as you can when you start to get sick. And then if you've got a sore throat and you kind of come today, when you start to feel it getting sore, you hopefully will be feeling better within a day and a half. Whereas if you leave it until it's sort of beautifully ulcered on the throat, then it will take longer.
Okay.
So
because the body's sicker.
Yes.
So there's more work for it to do.
Yes. So it all depends on, and it depends on how you're eating, and when you're sick, do you just eat toast and rubbish, or do you actually eat fruit and vegetables and keep your system going, because you have to have the nutrients for your body to actually heal itself. So there's combinations of drinking water, eating the right foods, taking the remedies.
So it's a very holistic approach.
Much more so.
And do you think that it can be used equally successfully for acute and chronic conditions, or is it more suited to one or the other?
No, equally. I definitely see both. And, obviously chronic is more difficult for people to deal with, because they've got to take, whether it's homeopathic or allopathic, they're taking things long term. So my objective as a homeopath is to always try and get people off medication, because even homeopathic things, they mustn't be taking them forever. But I understand that need for people to also take something. They need to know, they like to know that they're taking something so they're going to feel better. So it's with all that as well. But chronic, acute, you can treat it all.
Okay. And then the last question I have for you is that when you take homeopathic remedies, you need to take it away from food. What is the reason for that? Okay, so there's a lot of misconception, as people think the remedies won't work unless they're taken without. The remedies will still work, even if they're taken with a mouthful of food, but preferably not, because they go directly into your mucous membrane in your mouth. Okay. So if you then have food in your mouth, or you have a taste, or hot or cold, anything like that, they're not absorbed on a natural blood supply. So it's already about the blood supply in your mouth that is important. And so, as I say, that's why they always say 10, 15 minutes before or after a meal, because by then, hot, cold, taste, everything should have subsided. So your blood supply in your mouth should be normal. Okay, which means it absorbs. It's absorbed directly into the blood supply in the mouth. Okay. So it actually doesn't go into the stomach and be absorbed there. Whereas, there are certain tablets and things that you get that obviously go into your stomach and are absorbed there, but majority of the true homeopathic remedies are absorbed in the mouth. Okay. Oh, well, that's wonderful. Thank you. I hope that gave you an insight. As I say, the big things are that you've got to look at the like cures like, and the individual patient. Each patient is an individual. There's no two people that are treated the same way. Okay, so thanks, Georgie. I think that gives us, as listeners and viewers, quite a good idea of how homeopathy can really assist us hugely. And I think the one thing that Georgie didn't say is that one of the big bonuses is that a lot of the remedies are very healthy. They I should say that. Yes, they're all made from natural products. So when you look at it, they're all made from animals, minerals, plant-based products. They're a lot of interesting. They're doing a lot of research now at the Technicon, and I've never been involved in one of those provings, as they call them, because that's what they are called, because you're looking at getting a totality of symptoms of a remedy. But they're doing new ones all the time at the Tech, and so they are slowly modernizing it, if you want to call it that, with different things that are coming out nowadays. But if you go back to 170 years ago when he started basically with like 32 basic remedies. Those 32 basic remedies are still most of what I base my practice on. Wow. They still work. Yeah, so it's tweaking the basis of the knowledge that he... Absolutely. And I mean, they do all sorts of different things now, sort of thyroids and, using the organs that we know that are problematic. And so there are obviously certain modern things that are really, really worth looking at, and they will stimulate your system. So it's
it's brilliant. They keep carrying on with the research, which is amazing.
Sorry, and I do have one last question. Do homeopaths operate on people?
Oh no. Well, no, none that I know of.
Okay. So that's not part. They don't use the knife to.
No surgery blocks are done at all. So you don't do that kind of treatment at all. At one stage, homeopaths couldn't even get blood tests done and things like that. But that's all changed. So we can send off for blood, get blood reports and things like that. So there has been a lot that has changed over the years, and obviously we're still not completely recognized by medical aids and things like that, but that they're working on all the time. Our Homeopathic Association is wonderful, and I must just say that if you want to see a homeopath, please go to the Allied Health Professions Council website and look for a registered practitioner. There are lots of unregistered practitioners, and it really is important that you go to somebody who has been registered properly, because then they've trained properly. So
just give that website again.
Allied Health Professions Council of South Africa.
Okay, so, and if any of you have any questions or queries for Georgie, please feel free to, as always, either pop a question into the comment box below, or you can email me and I'll send it through to Georgie, or you can leave me a note on my website, which is www.sherryforsythcoaching.com. And if you have any specific ideas or experiences that you would like to share that will help us open the topic of really getting our bodies completely healthy, whether it be homeopathic in nature or not, please feel free to put your thoughts down, and we welcome any contribution that you can make. So until next week, thank you very much, and thank you, Georgie, for your time.
Pleasure, absolute pleasure. Your dog's barked at the appropriate moment.